Hi, I'm Jack Cush. I'm executive editor of RheumNow.com, the source of all good things rheumatologic, and this is the week in review as of Saturday, the 20th of February. Last week on RheumNow we covered a number of interesting topics. We'll start with the cool and interesting tidbits provided in the social media feed. We did a retweet to remind everybody of Dr. Jeff Curtis's blog on sort of an objective way of looking at why people may not want to go to treat to target, and looks at that sort of from a behavioral psychology view. Interesting article by Jeff. There's also some interesting information about why SPA patients, spondyloarthritis patients, may not do well, and predictive factors being age greater than 33, not surprisingly, low socioeconomic levels and educational levels, and the presence of smoking, but a high baseline DAS and not meeting ASAS criteria are also predictive. IL-36 in the news as a potential mediator in animal models of IBD could be important maybe later on in SPA-related diseases. Something we tweeted last week that we reported on earlier was the association between opioid use and a higher rate of serious infectious events in patients with rheumatoid arthritis. And myelodysplasia, not an uncommon disorder seen by many of us, but interestingly, of all myelodysplasia patients, 29% will have some kind of autoimmune disease led by hypothyroidism, ITP, RA, and psoriasis. Patients who do have autoimmune disease, in fact, may have better survival and less of a risk of transformation to AML. And then lastly, a French study showed that 21.4% of patients with SPA may meet criteria for secondary fibromyalgia. We had a number of good feature articles. I mentioned the one by Jeff Curtis that was very interesting. Another one that came up was hidradenitis was back in the news. As you know, hidradenitis has recently been approved for use with adalimumab. It was an orphan indication, but now we have good objective data and FDA approval for use of TNF inhibition in hidradenitis. Something that you may not be aware of is that actually hidradenitis patients have a higher rate of cardiovascular comorbidities, and this particular study that looked at almost 6,000 patients showed that there was, after adjusting for age, sex, smoking, comorbidities, education, they found that myocardial infarction, ischemic stroke, all cardiovascular associated deaths and major coronary events were significantly increased, as was all-cause mortality, with an increase of anywhere from 50 to 95%. An interesting finding that most of us may not be aware of, again, speaks to the association between chronic inflammation and the risk of cardiovascular events, even in a skin disorder like hidradenitis. Also an interesting report that actually surveyed program directors in multiple disciplines, orthopedics, PM&R, rheumatology, about their use of ultrasound in their programs. A number of years ago, last number of years, Artie Kavanaugh and I have been involved in fellow education, and I've always been shocked at the growing number of fellows who've been trained in ultrasound. It is the wave of the future, if you will. Again, with about 1/3 of the respondents giving their answers, the rate of musculoskeletal ultrasound training was 100% in physical medicine, 90% in rheumatology programs, and less in radiology and sports medicine programs. Again, this was not just access to, but didactic lectures and hands-on scanning. The lowest case volume was for radiology and sports medicine. The highest was for rheumatology and physical medicine. I think that's an interesting advance for our discipline. We also reviewed a number of the lectures that took place at the RWCS conference. Go to rwcs.com to look at those videos and to see what happened at the meeting in Maui last week. That's it for this week in rheumatology. Tune in next week at RheumNow. Goodbye.